most people don't know wetin dey really cause ulcer. They go tell you say na if you no chop, now you go get ulcer. No be say if you no chop, you go get ulcer. The thing be say some people for their body get one bacteria wey dey cause am. That bacteria na dey very common for the cause of ulcer. So most people wey go don do ulcer, they go just say I do test and say I get one bacteria na make me get the ulcer. Most times na dey cause am, but some people they can't worse their own problem. First of all, you get that bacteria, it don't give you small wound, then you know can't they chop, you can't they take body pain medicine anyhow, like diclofenac. That one, if you can make your ulcer worse, then some go tell you say if I chop beans, my chest don't catch fire.
Heartburn.
So if you know say you get food where you go chop go give you heartburn, what you supposed to do? Leave that food alone for a while. Leave am.
Okay.
Then some other people can't tell you say, I check Google, then say I get ulcer. Na lie. Because many things they will be like ulcer. So many other things they. So because say you dey get heartburn, no mean say you get ulcer.
You know they feel like say if you digest well now, your stomach dey
Because say but your chest they pepper you now, no mean say you get ulcer, because you get some other things wey look like ulcer. And for your mind, if you no follow doctor talk, even some of us sometimes we dey even miss am. And you get one kind heavy test to say if you do that test, we will come confirm am true whether you get ulcer. Now say man can't tell you. So if you know say you don't carry ulcer, give yourself, and you never see doctor, follow doctor talk, maybe no be ulcer you get true.
Doctor, this ulcer of a thing is disturbing me for now. Understand? And just I don't know how the thing just came all of a sudden. The thing, the heartburn and all that. I went to scan and check up. They said that there is ulcer, and they give me this. The doctor in the hospital give me this omeprazole and one mismatch like that, just understand. So I've been taking it. All this while, if we stop, sometimes it will rise again. If we stop, sometimes it will rise again.
Okay.
So I don't know.
Thank you. Very good one.
Doctor.
A very good one. Now, ulcer for some people they hard to go. Ulcer na wound for your belly.
Yes.
And if you get wound and the wound never heal finish, you can't go do small thing wey injure am if you come back again.
Okay.
Yeah, some people figure that thing go take. Why some people go dey lucky. Say you take medicine we then give you, you go dey okay. Sometimes if you take medicine for 1 month, 2 months, they go like that. So sorry say the thing they disturb you, but your journey feel long small. So what you go do be say try go back, we go check. And then if you can't get small money, make them do that final test. Get one final test to know whether na true ulcer you get. I mean, something else.
Where did they call the test?
And the test. Okay, make I call the name upper GI endoscopy. You know if you go do on your own, this one. You know if you inside your nose. So you know if you go do on your own, but they go put something inside your nose, enter your belly. Go come look am. Say, oh, true, now ulcer be this. Oh, no be ulcer you get. You get somebody who I know of recent, we go do am. We think say na ulcer you get since.
For Lagos, yeah.
Yes, I know am one-on-one. But no be ulcer you get, now something else you get.
Wow.
Yeah, so many things they like that where they look like ulcer. So if you know say you get small money, they talk small money because the test not too cheap. And I make they talk like that. But if you know say you get small money and if you do that test, you go good. Maybe you go see your doctor. Maybe they recommend that test. Maybe you go do one. Maybe you know true.
Yeah, whether
ulcer you get, so you go know how to fight the journey.
And that your guy since they treat us as sins.
And they treat us as sins.
So now they don't know the real wahala.
We don't know the real wahala. And in myself don't come down.
Down.
All of us don't know where we dey.
Wow.
Say CO.
Yeah.
Yes. So and many things they will look like ulcer.
Yeah.
And if you know they careful, you go miss them.
Okay, just a few questions off the top of my head. They get a certain kind of food when they give person ulcer, they encourage ulcer source for person belly. 1, 2, they get a time of the day when we say if you eat certain kind of foods or a kind of lifestyle, it affects you. When we say ulcer, it make and they happen more. And is it possible that ulcer they affect maybe a certain age, past a certain age? Let's say if you be smallie, or if you be man, or if you be woman.
The way you think be, first of all, be say everybody day as we day. Now some things will make you get ulcer. So that bacteria and drugs. Now, if you know say you get food where you chop and that food they give you heartburn, the best thing to do now make you avoid them. Food we get spices, beans, Even oranges. One of my patients been telling me before, say anytime she take orange, they get heartburn.
Yeah.
So if you know, say now so your body be, you get certain food where you go take, you go get heartburn. Leave them. Alcohol if it cause you heartburn. Caffeine if it cause you heartburn, and so many other things. Now, they decide which age or which age. If you get these things on ground, if you get ulcer, whether you day young or you day small. And then the one very important thing too, for very few people, very few cases, some of their ulcer fit enter cancer of the stomach. So they fit get cancer of the stomach from ulcer, from that bacteria. Very few people, and most people don't know. Say yes. So sometimes people will just sit down for house, they complain ulcer. If it be early stage, so make you just sit down for house and they talk say, nah, ulcer they do me.
Sure.
You understand? Yeah.
Why they shout
Sure. I never hear that one before. Say sure. Really, if it lead to cancer of the stomach.
Gastric cancer, yes.
God. In fact, recently, doctor, I could discover. Say in recent times, roasted corn they give me chest burn, heartburn.
As you like and rich.
I swear she fair, and I like her. I did shop away before.
I know the funny thing with this be now. Somebody go tell say forget, they do me anything. Now your body. So everybody, you need to know your own body, and waiting go make you get heartburn. Waiting go make you know they okay. Make you leave.
So make her leave roasted corn.
No versa, you go leave and small.
This one say make we ask you. Say Dr. Abeg. Also they give chest and back pain. This na Papa Osazua from Ojo Barracks.
Papa Osaz, very good question. Most time the pain for ulcer at the upper part. I been make one video. It is online, detailed video. You go see the picture of the pain. It dey waka sometimes go back. So you someone say the pain they radiate or the upper part of your chest, your epigastrium. You go waka go back. Can give you heartburn. That one day among, but some other things today we still get that same symptom. You understand?
Yes, so I want to ask, what is the symptom or the sign of this ulcer? Because I don't know my own. At times, if I'm hungry, my belly will start paining me or pinching me. If I can't take the food, it can't be worse. If I did not put my belly on the bed, it will not release.
Very good question. Because of time. Yes, very good question. The symptom generally, the common symptom now, belly with the pain, you heartburn, common for people. Sometimes after you eat food, some people their pain feel worse. Some people 2 to 3 hours after they eat food, then their pain, because we get two types. We get some type of ulcer. We get gastric, we get duodenal ulcer, and each of them get how their kind of pain they be. So heartburn generally. Number 2, whether you eat food, immediately after you eat food, your pain catch fire, increase. If it be gastric ulcer. Why for some people in the night you go to sleep, you go just wake you up. You can't complain, my chest. That's one a sign of duodenal ulcer and so many other things we feed there.
Okay, I did that call. Hello, this is the phone line.
Hello, good morning.
Morning to you.
Right, good morning.
Morning.
Good morning, sir.
Good morning.
Dr. Abel, my question goes like this. This ulcer, they make person belly big. Now, what I want to ask?
Mama the mama.
Okay, thank you. For the symptoms of ulcer, there's no area. For the symptoms, say person belly go big.
Yeah.
But ulcer get complications.
Okay.
The common complication are bleeding. Person feel they vomit blood, feel they bleed inside.
Sure.
Yes, that one day. And if you rush the person enter inside operation.
Sure.
Wow.
Yeah. And that thing again, if you make the where food to pass, con day slow, block. Your belly can increase. That one a complication. Gastric outlet obstruction.
Wow.
So no, you just wake up talk say because your belly they big, you get ulcer. You need a professional to help you, and not just sit down for your house, go Google or allow your neighbor. Now ulcer they do you. Not be so they work. You need a professional to help you make the diagnosis and the treatment. Sometimes they very long. So if you start treatment for ulcer, not just think say I don't take on this week. It don't finish. No, your treatment day long.
Okay, who did the line? Make the drop on us the hot.
Now wow.
Oh, good morning. Good morning.
Madam, morning. No.
Chief, good morning.
Welcome to you, mommy.
Morning.
Mommy Esther from Ecos.
Mommy.
Doctor, please, I have a heartburn. Does it mean I have ulcer?
No, I no go say yes because I just talked on before. Yes, we get so many things we look like ulcer. We get gastritis. That's what we call gastritis. Gastritis simply means inflammation of your stomach wall there. And one symptom of gastritis is heartburn. And that symptom of ulcer na heartburn. And that symptom of gastroesophageal reflux disease na heartburn. So many things they we go give you symptom of heartburn. So because you get heartburn, madam, no means say you don't get ulcer.
Okay.
You understand? Yeah.
Okay, we could pick a couple more.
Hello.
Hello, doctor. Good morning.
Good morning.
Doctor, my question is, how many years can person dey experiencing this ulcer? Small children, like as from 10 years up, experience it.
Okay. Most times we know they say ulcer for children, but children fit get ulcer. Most times. And that bacteria, well, I make a video about this ulcer. I did YouTube, my YouTube channel, detailed video. So you go know how people they get that infection safe from small. Most people don't carry them, and now from childhood, now most of us they get that infection till we grow. So children fit get them, but you know they common for children.
Okay, thank you so much.
This ulcer of a thing, I love what they are discussing. Sometime last year, I was having this problem. That each time I eat, something blocked my upper abdomen.
Okay.
So I went to General Hospital. They say it's ulcer. Though they gave me omeprazole and other liquid, which I took for like 3 months. But sometimes it looks, when I eat now, it looks as if I'm having reflux, as if the food is
acid reflux.
not digesting.
Okay.
So what is it?
Okay. Thank you for your question, mommy.
Okay, thank you. Reflux no be ulcer, you understand? So if it be totally something different, what you go try do, take note of those things where they trigger your reflux. Take notes, the time where you dey chop, the food where you dey chop. Just take note of those stuff. As long as you don't take your medication before and you dey fine, I believe so you go dey fine. But take note of those things where they try trigger your reflux.
You never download the Wazobia FM app? Chai! You dey miss wella. Oh yeah, download our Wazobia FM app today on top Apple Store and Google Play Store. Make you fit listen anywhere and everywhere. Join the Chukmat family today.
Wazobia FM 95.1.
Chuk Mouth.